Welcome to Section 4 of Gastrointestinal Embryology. In this section, we'll be discussing intestinal atresia. Let's get started. For clarity, intestinal atresia can occur during development anywhere along the small intestines. However, it's best to break up intestinal atresia in terms of duodenal atresia and jejunal/ileal atresia, and we'll go through both of these, starting with duodenal atresia. Duodenal atresia occurs because there's a failure to recanalize the duodenum, specifically the portion distal to the pylorus and the common bile duct. And it's associated with Down syndrome in 30% of cases, meaning 30% of patients with duodenal atresia have Down syndrome. Now, this image demonstrates duodenal atresia and its consequences. Let's first focus our attention on the left part of the image. You can see the duodenum here, and you can see that part of the duodenum failed to recanalize, leading to this duodenal atresia. So instead of becoming hollow like the rest of the GI tract, it's blocked off. And as you can see, this atresia is located distal to the pylorus, as well as the common bile duct. And this fact will help you understand why these patients present the way they do. So we'll come back to this and discuss the image on the right in a moment. When it comes to the findings of duodenal atresia, it's best to break it up into prenatal findings and postnatal findings. Prenatal findings include polyhydramnios and a double bubble appearance on an ultrasound. So let's discuss why these things occur. Well, polyhydramnios occurs because the fetus cannot swallow sufficient amniotic fluid, and that's because the fluid can't pass the duodenum. This means that amniotic fluid will build up outside the fetus, hence the term polyhydramnios. And since there's amniotic fluid building up distal to the pylorus, then the fetus demonstrates this double bubble appearance. So coming back to this image of duodenal atresia, focus on the right portion now. As you can see, the fetus swallows amniotic fluid, which you can see here. Then it builds up distal to the pylorus. You can see it back here. The pylorus is a sphincter, so it stays tight for the most part. This creates two bubbles, one for the stomach and one for the proximal duodenum. So the patients are said to have a double bubble appearance. And prenatally, this is an ultrasound. And postnatally, this is done through X-ray. Now let's focus on postnatal findings. After birth, the amniotic fluid is distal to the pylorus, so you can still see that double bubble appearance on an X-ray. And since amniotic fluid can't pass the duodenum, the patient can experience abdominal distension. And since the bile can't pass the duodenum, the patient will have bilious vomiting. Here's an X-ray showing that double bubble sign seen in duodenal atresia. You can see an enlarged stomach, and you can see that proximal duodenum. Now let's discuss jejunal and ileal atresia. The mechanism for jejunal and ileal atresia is typically superior mesenteric artery occlusion. This leads to ischemic bowel necrosis. And knowing this mechanism will help clarify why jejunal and ileal atresia have certain findings that don't occur with duodenal atresia. So let's explain that more. And let's start with the prenatal findings. The main prenatal finding is polyhydramnios. And just like with duodenal atresia, this occurs because the fetus cannot swallow and pass sufficient amniotic fluid. So there's just too much fluid outside the fetus. And the first postnatal finding is also similar to duodenal atresia, and that is abdominal distension. The swallowed amniotic fluid will build up proximal to the atresia. So the newborn will have abdominal distension. And just like before, the patient, for various reasons, is uncomfortable and will vomit. And since bile cannot pass through the small intestines, that vomiting will be bilious vomiting. Now, the last finding is unique to jejunal and ileal atresia, and that's the apple pill appearance. And this can be seen on X-ray or grossly during a surgery. This occurs because the distal bowel will spiral around a small branch of the SMA, and this spiraling makes the appearance of an apple peel. This image depicts jejunal and ileal atresia. So let's focus on the left to understand the pathophysiology. So there's arterial occlusion of some kind, and that's typically within the SMA, or a small branch of the SMA. This leads to ischemic necrosis, because there's parts of the jejunum and ileum that are not getting blood supply, so they experience ischemic necrosis. And this leads to the intestinal atresia. Again, we're referring to jejunal or ileal atresia. So you can see that atresia right here. Now let's focus on that distal portion of the bowel. Well, what happens is the distal bowel will start spiraling around a small branch of the SMA because it's trying to maintain some vascular supply. And so it ends up getting this weird circular apple pill appearance. Now looking to the right image, we can see the presentation. Amniotic fluid builds up and it leads to abdominal distension. You can also see that green bile building up. And so when the patient vomits, it will be bilious vomiting. So now that we've covered intestinal atresias, let's do a question to apply what you've learned. A newborn demonstrates bilious vomiting and abdominal distension. Imaging reveals a second bubble just distal to an enlarged stomach. In utero, did this newborn more likely experience ischemic bowel necrosis or failure to recanalize a portion of the small intestines? So hopefully from the question stem, you noticed the double bubble sign. There was a second bubble just distal to an enlarged stomach. This points to duodenal atresia. Recall that you should break up atresias into duodenal atresia and jejunal/ileal atresia. Duodenal atresia occurs because a portion of the duodenum fails to recanalize. So that leads to duodenal atresia, and the patient can demonstrate that double bubble sign. Whereas jejunal and ileal atresia occur because of SMA occlusion, which leads to ischemic bowel necrosis. So those patients will get jejunal or ileal atresia. So going back to our question, in utero, did this newborn more likely experience ischemic bowel necrosis or a failure to recanalize a portion of the small intestines? And that would be a failure to recanalize. And that concludes this section.